Welcome to our video on Moxibustion. The process of Moxibustion typically involves either direct or indirect methods. In the direct method, a small cone or stick of Moxa is placed directly on the skin and ignited, allowing the heat to penetrate the acupuncture point. This approach provides a powerful warming sensation and delivers therapeutic benefits to the area. Indirect Moxibustion, on the other hand, uses a layer of protective material, such as ginger or garlic, between the Moxa and the skin, reducing the risk of burns while still allowing the heat to transfer effectively. Each method has its unique advantages, catering to different patient needs. Moxibustion is believed to enhance the flow of qi, or vital energy, throughout the body. Practitioners assert that this technique can aid in alleviating various health conditions, including pain, digestive issues, and menstrual disorders. Research suggests that Moxibustion may be particularly effective for people suffering from arthritis, back pain, and even certain types of infertility. By applying heat and stimulating key points, Moxibustion can help address imbalances in the body and promote overall wellness. In addition to its physical advantages, Moxibustion also fosters a sense of relaxation and emotional balance. Many individuals find that the warming sensation and soothing practice enhance their mental clarity and emotional well-being. As a complementary therapy, it can be used alongside conventional treatments, making it a versatile option that appeals to those seeking a holistic approach to their health. In conclusion, Moxibustion stands out as a fascinating and beneficial tradition within the realm of alternative medicine. Its ability to stimulate acupuncture points, promote healing, and improve overall well-being makes it an intriguing option for those interested in exploring holistic health practices. As with any treatment, it is important to consult with healthcare professionals before beginning Moxibustion to ensure it aligns with your individual health needs.